Good morning, good afternoon, good evening, all good. If you're a returning viewer, thank you for coming back for more. And if this is your first time on my channel, I am Pharmacist Girls Gift, and on this channel, I talk on health matters and drug information. Right on this video, I'm going to tell you a lot of things you need to know about self-medication, the dangers of self-medication, what the self-medication is, and also how to prevent self-medication, what you need to know about self-medication. If you are yet to subscribe to my channel, I would like you to do so right now. Click the subscribe button and also put on the notification bell. Self-medication is the self-administration of drug, medicine, or herbs which have not been prescribed by the doctor or health personnel, or person taking drug that has been given to them by others that are not still health personnel. That is what is termed as self-medication. And this self-medication has a lot of dangers to your body. And some of those dangers are what I want to discuss with you right on this video. I would love everyone to try as much as they can to stop self-medication. Self-medication is never advised and it won't be advised. Let me tell you some of the health risks of self-medication. Self-medication causes resistance to drug like the antibiotics. Let me explain this for you. Resistance in the sense that the drug or antibiotics which a person will want to take for a particular condition to destroy or kill the microorganism, the drug cannot kill that microorganism anymore. Rather, the microorganism is surviving in the presence of the drug and also causing more harm to the person involved. That is what we mean by drug resistance. The drug cannot kill the microorganism. The microorganism have gotten resistant to that drug, and this makes one to go for higher brand. That is what happens to when you abuse drugs, when you do self-medication to drugs like antibiotics. That is why we health provider always warn against the abuse of Bisham ampiclos, which normally they take one capsule after having unprotected sex. This is not advised because you are causing resistance to that ampiclos that you are abusing. Secondly, drug abuse leads to kidney disease. This kidney is a very wonderful organ that does a lot of function. The kidney is mostly responsible for filtration of substances, filtration of bad or unwanted substances from the body. Even drug particles, it filters drugs. Like I previously said, self-medication involves the use of herbs or drug. Now, let me give you an example. These drugs that you normally take have gone through the lab. They have been synthesized and every unwanted part in that drug have been reduced. And this drug, we normally get this drug from the herbs, from the plants that are everywhere. Now, let me say you consuming these plants, these herbs that have not been synthesized, that the harmful effects of the herbs have not been removed. You are consuming these herbs into your body and the kidney wants to filter this herb. Do you know that the harmful effect of that herbs that have not been removed by synthesis or any other process, do you know that part can lead to kidney destruction? Do you know that that part can destroy your kidneys, leading to kidney failures, kidney stones and the rest? There is very, very bad. That is why I said the agbo, concussions we take up and down, we should avoid those things. They are not healthy for your kidneys, neither are they healthy for your liver and other organs of the body, because every drug you take in comes from these herbs. Yes, the herbs are effective. That is why the pharmacists have made it that they will go to and take survey of the plants and bring it to the laboratories or processing units to process and remove the dangerous substances that are not good for the body, and use that good part to produce the drugs that we normally take. But you taking concoction medication, taking agbo without removing or doing anything, or you think by boiling you have killed the harmful constituent. No, by boiling you have not destroyed that harmful constituent. That harmful constituent sometimes need to go through chemical processes that are very, very essential. And also, this boiling that you do can also kill the active ingredient, or the ingredient that is responsible to cause or to heal the person in that herbs that you are using. Self-medication with drugs with herbs should be totally avoided. Thirdly, self-medication can lead to death. Yes, I said death. As I've previously said, most of the herbs or the drugs we take, we don't know what they are. Now you look at it this way. You taking drugs that are made for persons that are for hypertensive just because you feel that you're feeling weak, or you're having this a headache that refuse to go, or this or that, you feel that you're having high blood pressure, without going to check yourself, you rushed into taking those drugs that are meant for that person that already have the high blood pressure. Do you know that you can die instantly? Because you don't know the dose, you don't know if it is actually high blood pressure that is your problem, or is another underlying disease. That is one of the bad effects of self-medication to your body. So it is always advised to ask your health provider, go to the hospital, take your vital signs, take your blood pressure, to be able to know which drugs are good for you and the drugs that are not needed for you. Also, fourthly, self-medication can lead to liver problem. Overuse of paracetamol. Sometimes when we are sick, we feel that 2 tablets of paracetamol is not okay. We would want to take 4 tablets of paracetamol, which is just like 2 grams of the paracetamol. That is not necessary. It leads to liver problem. There are a lot of drugs also that lead to liver problem, but paracetamol is the commonly abused drug, or the people usually take to do self-medication. That is how I'm bringing it out right now. The paracetamol that we take, that we want to take it for more than 5 days, or want to take it for 1 week, 2 weeks, like, no, it is not right. Paracetamol is taken 3 to 5 days. Those are the highest days you can take paracetamol is 5 days, and you take 1 milligram or 2 tablets 3 to 4 times daily. Paracetamol doesn't require you to take 4 or 5 tablets at once to heal that pain that you are feeling. For self-medication leads to liver problem also. Then let's move a little bit to the pregnant women. Do you think that self-medication is ever advised for the pregnant women? No, because the pregnant women are very delicate set of people. The pregnant women and the children. I will move to the children after the pregnant women. The pregnant women don't need self-medication, but most pregnant women also still go for self-medication. Self-medication, like some antibiotics and also some drugs, are not needed for the pregnant women, because it can lead to abortion and also deformations in the baby or unborn child in the stomach. Like, let me say, pregnant women with diarrhea, that they don't go to their doctors or their nurses that usually take care of them, or their antenatal nurses. They just rush and go take tetracycline. Do you know that tetracycline in pregnancy is very wrong, and it can lead to bad dentition in the baby? It can lead to deformities in the baby. And also there are other drugs like the strong analgesics that the pregnant women take that can lead to bleeding and abortions in the pregnant women. So for the pregnant women, it is advised that you quickly run to your health provider. Don't say this pain is mild, you can just take 1 or 2 pain relief. No, those pain relief have stages that they should be taken. Some don't even need to be taken by the pregnant women. So that is why they are very delicate, and they should always seek the advice of their health provider before taking any medication. Now let's go to the children. The children, we think that you can give any pain relief, you just paracetamol, you just cough medicine, you just antibiotics, so you don't need to check. No, the children dosing is very, very different. That is why I say self-medication is a very wrong idea, because the children, you need to know the dose. The dosing has to do with the weight of the children. You first of all take their weight, and also know their age and the condition they are before you give these drugs. You want to say you want to give 5 ml paracetamol to a baby. You don't know if the 5 ml paracetamol is okay for that baby. Can that baby weight take that 5 ml paracetamol? Can that baby liver and other organs take that 5 ml paracetamol? You don't know. But because you feel you gave it before and it's good, you want to go and give it again. The first time you give it, thank God, but you don't know the damages it has started to cause, and you are going to give again, causing more damage. I'm advising every mother, every father, before you give your child any drug, take your child to the health provider. Let them weigh that child. Let them know the condition that child is and give you the right dosage and the right drugs for that child. Don't do self-medication for a child, for a pregnant woman, and also yourself. I previously met some patient, a patient that said, it doesn't matter that he went to do self-medication, that he was feeling he has infection, that he went to take Bisham ampiclos. Yes, Bisham ampiclos. That he took it for like some 1 week, or that he took only Bisham ampiclos for 1 week, and the thing left him. And now the way he's feeling, and he's like his whole body is not with him. That he took Bisham ampiclos, he went to a chemist, and also they mixed other drugs for him. Now his stomach, that he's having this hotness in the stomach, that his back, he cannot stay. I was like, why do you go to give medication? He said, it's normal now. He has been doing it before and nothing, that he don't know what happened this time. That's now where I came in. I said, it's not normal. It has been working, but causing harm in your body. Unknown to you, it has been working, but to your body, it has been causing harm. Now the manifestation of the harm has come to play, and now you're saying the drug did not work for you. No, the drug worked for you, but the drug were not taken properly. They were not taken at the right doses, so they have caused effect to you. Self-medication leads to ulcers, mixing of over-the-counter painkillers. Over-the-counter painkillers, like you want to mix 2 to 3 painkillers at once to take. No, that is not how it is done. You can't mix your ibuprofen, your diclofenac, your piroxicam just to knock that pain down. No, you are causing ulcer for yourself. You're causing stomach ulcer, bleeding in the stomach, wounds in the stomach, or sores in the stomach that will affect you greatly in life later on. Now let's go back to the man. I then asked him, why did you take the ampiclos for that infection that you said you are treating? He said he took it one morning, one evening, and he said, sir, this is not how it is being taken. You are abusing this drug. You are causing resistance of these antibiotics to yourself. Next time, if you are going to take this ampiclos for more serious thing, you will notice that this ampiclos will not work effectively for you, because the organism in your body has already gotten resistant to this drug. They are like strong men now are telling you that this your drug cannot kill me, this your drug cannot fight me, so we are stronger than your drug, you can't do anything to us. That is just exactly how the organisms are telling that antibiotics, that ampiclos that you are taking in. The man was surprised. And I told him that ampiclos, you take it 4 times a day. 4 times. I have to advise him on the right way ampiclos is taken. And I also have to advise him on the dangers he's doing to his body as he's doing self-medication. After a section with me, he had no choice than to come for proper treatment, and self-medication is a big problem in Nigeria, and we need to stop this self-medication. There are a lot of dangers of self-medication if I want to continue. As a health provider, I am pharmacist God's gift, so I'm telling everyone out there, don't do self-medication with your child, with your pregnant woman, and also with yourself. Don't do self-medication. You are damaging your organs. You are damaging your body. That is why you see this day kidney disease is very rampant. It's rampant like something else. You will see even within the ages of 20, you are seeing them coming up with kidney disease. No, all those are effect of self-medication, especially to the ladies that feels that you will go take any over-the-counter painkiller to remove that menstrual cramp. You overuse them. That's cause bleeding, internal bleeding like ulcers in your body. Ulcers are sores or wounds that are found in the stomach because of use of NSAID or microorganism. So NSAID, which are drugs, which are painkillers, can actually lead to ulcers also. So everyone, please, your pharmacist, God's gift, is begging you to stop self-medication. I know that Google is your friend. You will go browse, what can I take for this pain? Google will tell you what to take. Go. But know that I am your health professional, your health provider, and we are trained professionally in these areas, and we know and we have seen a lot to tell you the right thing to do and the right way to follow. So therefore, my fellow Nigerians, please stop self-medication. What are you waiting for? So with all this that you've heard, why don't you give this video a like? Give it a share, subscribe to my channel, and also don't forget to comment in the comment section. Thank you, and see you again for my next video. Bye.